We were not presented with any other options. It was, you have a fetus that is presenting certain abnormalities, and so the next step is an abortion.
One of the things that I love about Dr. Parravicini is that she practices not only the science, but the art of medicine. To use your clinical expertise, but also to see your patient as a human being.
She was like, I know this amazing doctor, Dr. Parravicini. She's got this wonderful ministry, essentially, helping children who are like James and parents like you guys.
I was absolutely captivated by her manner, right? By her compassion and by her vision of what perinatal hospice care should be like.
Elvira would be doing this as a professional of high credentials, as a physician, but she's also doing it as a woman of faith, and in her mind the two cannot be separated.
Her Catholic faith doesn't depart from medicine, it enriches and develops medicine.
One of the things that I really love about Dr. Parravicini's approach is that comfort isn't just the absence of pain. Families know that their little one is going to receive all the love and care and honoring of their human dignity that we can provide.
The Neonatal Comfort Care Program is an indispensable form of medical care for parents.
It's actual care.
Yeah.
We have desire in our hearts, can be suppressed. So if I have the desire to heal every single baby, how do I deal with that when medicine is not enough? I realize life is given, and the first day of life and the last day of life is not decided by us. Saving the life of those babies is serving the life of those babies as God wants. I was born and raised in Italy, in Milano. When I was in 5th grade, I wrote a little essay that when I was going to be a big girl, I would get married and have 21 kids. But I realized if Christ is God, I want to give my life to Him. I joined Memoris Domini. We live obedience, poverty, and chastity. But the essential is doing our jobs in the memory of Christ. Remember that He is the consistency of everything, of every person. As a neonatologist, I'm called to meet families expecting babies with any kind of problems. I ask questions about the little baby. They have a name. I want to use that name if possible during our interview to make sure they understand I am the one who stands for their baby. I always say congratulations. When they learned that they were pregnant, they were like, yay! But then this fear for the baby to suffer, for themselves to suffer, is very overwhelming. That's why our program stands with families carrying a baby with life-limiting condition, because alone is very, very difficult. Some parents choose to abort their baby. We don't judge anybody, but myself and my team want to support the desire in their heart. We offer a proposal. And the reality is, when the baby is born, it's always a moment of glory.
We've seen abortion become a pretty typical response to receiving a diagnosis in utero of some serious medical problem or illness. These are corruptions of the practice of medicine. They're not scientific medicine, they are a particular moral account of medicine that has gone wrong.
Oftentimes as a bereavement doula, I get the call after a family finds out that there's some kind of adverse outcome. So perhaps the baby has already died, perhaps the baby is likely to die fairly soon, or perhaps we are guessing at this point the baby's going to die sometime after birth. First thing that most families want is answers. And so that's why having grief-informed physicians and incredible scholars like our honoree who are able to take these really hard realities of life and distill them into answers that families can start to grapple with and understand as they make a plan. That's so vitally important.
When parents receive these diagnoses of life-limiting conditions for their children, about 80% will choose abortion. When a supportive care is offered, such as perinatal hospice, that statistic flips entirely to the point where 80% will choose life, will choose this alternative. And what I think that speaks to is just a deep instinct of parents to care for their sick children if they're offered it.
Being able to create this program and have it seen as something positive, we have made tremendous inroads, particularly in the obstetrical side of things, and especially for the maternal fetal medicine specialists who were at a loss as to how they could journey with these families whose babies had life-limiting conditions.
This fundamental witness to the intrinsic dignity of the human person, bearing the image of God. Every person, including those who are diminished and small and frail, every one of them retains their dignity throughout their life. It's a witness that can't be overstated or ever let go.
My OBGYN said that in the New York City area, people abort for everything. And he said, because that's the culture, doctors here don't know how to handle your situation. And I felt angry and helpless. It's our faith, it's the strong belief that James is a baby, a person, an eternal soul. Like having someone understand that, affirm that, and also have like the medical expertise was just an incredible blessing. Our number one wish was if he lives for just a minute, for like a few seconds, if he's baptized, that means the world to us. We went in with a C-section. The C-section kind of went sideways, his heart rate went down, and so I was put under general anesthesia.
Dr. Parravicini is the one who came to give me an update, and she comes to me with incredible tenderness and looks me in the eye and says, James was born alive and he's baptized. I baptized him the moment he was born. But he's not going to make it. Dr. Parravicini's team had beautifully wrapped him up. I go to hold him and he's still alive. And he gave little kicks. It just felt in that moment like God was just saying, like, I'm here with you. And there was not a dry eye in that operating room. The medical staff went from skeptical and being like, why are you willing to make medical choices such as a classical C-section for the sake of a baby who doesn't really have a chance, to then really being moved, seeing the sanctity of life. I was able to be there for him as he was moving on from this life. And that was all enabled by Dr. Parravicini and her team.
Notre Dame's awarding of the Evangelium Vitae medal to Dr. Parravicini holds her up, right, as an amazing witness, right, to life.
Pope St. Paul VI, he had the beautiful word that contemporary men and women learn more from witness than from words. You see that in action when you watch Dr. Parravicini so tenderly and courageously care for this tiniest, most fragile, most brittle example of human life. So thanks to Nicola Center, thanks University of Notre Dame for choosing this wonderful woman to receive this Evangelium Vitae award.
You know, medicine is a call, and it's interesting that I start my profession as a doctor willing to save baby's life, and I would never do palliative care because I thought it was giving up. And then in reality, God made me in a position that I'm building this big program of perinatal palliative care. I see His hands giving me these babies to take care of, and I can see that beauty pulls you. And so to me, the confirmation for God is like my everyday job.